Good afternoon, everyone. My presentation is titled Exercise in Poor Air Quality, Implications for Older Adults. Poor air quality is becoming an increasingly important issue for exercise professionals because many people exercise outdoors, including older adults and individuals with chronic diseases. While exercise provides many health benefits, exercising in polluted environments may place additional stress on the cardiovascular and respiratory systems. Today, I will review current research on exercise and poor air quality, discuss what the literature says about both the benefits and the risks, and explain how exercise prescriptions should be modified for older adults. I will also provide practical recommendations that exercise professionals can use to improve safety while still helping patients remain physically active. Poor air quality occurs when pollutants in the air reach levels that may negatively affect human health. Common pollutants include particulate matter, often called PM2.5 and PM10, ozone, and nitrogen dioxide. These pollutants can come from vehicle emissions, industrial activity, wildfires, and other environmental sources. During exercise, our breathing rate increases and we take in more air. This means that we also inhale more pollutants. As a result, exercise performed in polluted environments may increase exposure to harmful particles and gases. For healthy individuals, this may cause temporary respiratory irritation or increased cardiovascular strain. For adults and those with chronic diseases, the risk may be greater because they often have reduced physiologic reserve and may already have cardiovascular or pulmonary limitations. Understanding these effects is important since outdoor exercise remains one of the most accessible and recommended forms of physical activity. The first study was conducted by Andrade and colleagues in 2023. This was a mapping review that examined 58 studies focused on older adults, physical activity, and air pollution exposure. The researchers reviewed evidence involving common pollutants such as PM2.5, PM10, ozone, and nitrogen dioxide. This review found that poor air quality was associated with negative cardiovascular and respiratory outcomes. However, one of the most important findings was that physical activity often continued to provide meaningful health benefits despite pollution exposure. The authors did note that cardiovascular outcomes appeared to be affected most often. This study is important because it directly examined older adults, which is the population I will focus on later in the presentation. These findings suggest that exercise should not necessarily be avoided when air quality is less than ideal, but steps should be taken to reduce pollutant exposure whenever possible. The second study was conducted by Jin and colleagues in 2024. The researchers examined healthy young adults who exercise under different levels of air pollution exposure. They evaluated cardiorespiratory responses and markers of inflammation. The study found that higher levels of pollution were associated with increased inflammation and reduced cardiorespiratory benefits from the exercise. So, in other words, the body experienced greater physiologic stress when exercise occurred in more polluted conditions. Although the participants were healthy adults, the findings are important because they show that pollution can negatively affect exercise responses, even in people without chronic disease. For exercise professionals, it suggests that individuals with existing health conditions may even be more vulnerable to these effects. The third study was conducted by Steve and colleagues. This study examined older adults exercising outdoors, while researchers monitored environmental pollution levels and physiologic responses. The researchers found that pollution exposure was associated with changes in cardiovascular responses during exercise. Older adults appeared to experience greater physiologic stress when pollution levels increased. These findings are especially relevant because they reflect real-world outdoor exercise situations rather than highly controlled laboratory conditions. This study also reinforces the idea that older adults may be particularly sensitive to pollution exposure during exercise and may require closer monitoring and program modifications. The fourth study was conducted by Tenio and colleagues in 2021. The review examined evidence related to physical activity and air pollution across multiple populations. And one of the most important conclusions was that the physical activity generally remained beneficial, even when pollution exposure was present. Although pollution reduced some of the positive effects of exercise, the overall benefits of regular physical activity usually outweighed the risk associated with moderate pollution exposure. By the way, her name is Roxy. Say hi. This is an important point because patients sometimes believe that they should avoid exercise completely when environmental conditions are less than perfect. The literature suggests that a better approach is often to modify exercise conditions rather than eliminate physical activity altogether. And this fifth study was conducted by Lugilo and colleagues in 2024. So researchers examined healthy adults who were exposed to elevated levels of PM 2.5, which is one of the most concerning forms of air pollution since the particles are small enough to enter deep into the lungs and the bloodstream. The study found measurable cardiopulmonary effects and increased physiologic stress following exposure. Although the study involved healthy adults, the findings provided additional evidence that PM 2.5 exposure can affect exercise tolerance and overall physiologic function. For exercise professionals, the findings show the importance of monitoring the air quality conditions before recommending outdoor exercise. Overall, when examining all 5 studies together, there's several common themes that emerge. First, there is a strong agreement that poor air quality increases cardiovascular and respiratory stress during exercise. Second, PM 2.5 appears to be one of the pollutants most consistently associated with negative health effects. Third, older adults and individuals with chronic disease appear to be more vulnerable than healthy young adults. At the same time, the literature also shows that exercise continues to provide important health benefits. Most studies suggest that physical activity still should be encouraged because its benefits often outweigh the risks of moderate pollution exposure. So, the goal is not to eliminate exercise, but to reduce unnecessary exposure while maintaining physical activity. This balanced approach is especially important for populations that depend on regular exercise for disease management and functional independence, because it still shows an option to get physical activity in, but also notifies the risks. Although the literature provides valuable information, there are several limitations that still exist. So many studies involved healthy participants rather than patients with cardiovascular disease, diabetes, pulmonary disease, or any other chronic conditions. Many of these studies also take place in laboratory settings, which may not fully represent real-world exercise environments and show actual pollutants in real time. Because of these limitations, exercise professionals must use clinical judgment when applying findings to patient populations. And despite these limitations, the evidence is still useful. It provides a strong foundation for making practical exercise modifications that reduce exposure while maintaining the health benefits for regular physical activity. For this presentation, I selected older adults as a special population. And several factors make this group especially important when discussing poor air quality. As we all know, aging is associated with reductions in lung function, cardiovascular reserve, and overall physiologic adaptability. Older adults are more likely to have chronic conditions such as coronary artery disease or CAD, hypertension, diabetes, and chronic obstructive pulmonary disease. Because of these factors, older adults may have a more difficult time responding to environmental stressors such as air pollution. As exercise professionals, we must carefully consider these factors when designing exercise programs. Poor air quality can also increase several risk factors for older adults. Some potential symptoms include shortness of breath, elevated blood pressure, increased cardiac workload, excessive fatigue, and reduced exercise tolerance. Warning signs that require immediate attention include chest pain, dizziness, unusual shortness of breath, wheezing, and significant fatigue. Exercise professionals should educate patients on recognizing these symptoms and encouraging them to report any unusual responses during exercise. Monitoring becomes even more important when exercise is performed outdoors during periods of reduced air quality, as this can show a bigger risk of seeing some of these symptoms. And there are several modifications that can improve safety while maintaining exercise benefits. First, moderate intensity exercise is generally preferred over vigorous exercise when air quality is poor. Second, shorter exercise sessions may be appropriate initially, especially for individuals with chronic disease. Third, indoor exercise may be a better option when air quality levels are elevated. Examples include treadmill walking, stationary cycling, and resistant training performed in a facility with good air filtration. Exercise frequency should generally remain consistent because regular physical activity is still important for overall health. The goal is to maintain exercise participation while reducing pollutant exposure as much as possible. If we are able to make this a need, it is more likely that we will avoid any of these risks and limitations moving forward. So the current literature consistently shows that pollution increases cardiovascular and respiratory stress during the exercise. The older adults appear to be especially vulnerable because of age-related physiologic changes and higher rates of chronic disease. But at the same time, exercise remains one of the most effective tools for improving health and maintaining independence. Therefore, the best approach is not to avoid exercise completely, but to modify exercise conditions, monitor patients carefully, and reduce pollutant exposure whenever possible. By applying evidence-based exercise prescription principles, clinicians can help older adults remain active, improve health outcomes, and exercise safely, even when the environment conditions are not ideal. Thank you for your time, and I appreciate your attention during this presentation. Thank you.